left. Now, around the heart, if we consider that this is the heart, around this heart there is a double layer membrane, like this. Double layer membrane, that is called as pericardium. These two layers are there to protect the heart from shocks and injuries. These membranes are called as pericardia or pericardial membranes. In between these two, there is a fluid, and that fluid is called as pericardial fluid. You know that in the heart there are no bones, only vessels are there, tissues are there. Therefore, it is a very delicate organ. To protect it from shocks and injuries, there is a pericardial fluid. This fluid, if you fall down suddenly or someone hits you on the chest, heart is not damaged. What is the reason? Whatever physical shock is there, that physical shock is absorbed by this pericardial fluid, and the heart is protected from shocks and injuries. So, that is about the protection of the heart. Left. Now, around the heart, if we consider that this is the heart, around this heart there is a double layer membrane, like this. Double layer membrane, that is called as pericardium. These two layers are there to protect the heart from shocks and injuries. These membranes are called as pericardia or pericardial membranes. In between these two, there is a fluid, and that fluid is called as pericardial fluid. You know that in the heart there are no bones, only vessels are there, tissues are there. Therefore, it is a very delicate organ. To protect it from shocks and injuries, there is a pericardial fluid. This fluid, if you fall down suddenly or someone hits you on the chest, heart is not damaged. What is the reason? Whatever physical shock is there, that physical shock is absorbed by this pericardial fluid, and the heart is protected from shocks and injuries. So, that is about the protection of the heart. I told you about these two membranes, pericardial membrane. Here you can see that the heart is divided due to this muscular partition, which is called as the part of heart, which divides the heart into two equal parts, left and right. So again, if we draw the rough figure, because of this is called as the partition wall. Because of this partition wall, the heart is divided into two parts, left part and right part. Again, you can see here this one as well as here second one. These are called as the valves. One and another. These are the valves in the heart. Bicuspid and tricuspid. Bi means two. Here there are two folds. That's why it is called as bicuspid. And here there are 1, 2, 3 folds. Therefore, this is called as the tricuspid valve. So, because of these two valves, the second, third and fourth. There are 4 chambers of heart. 1, 2, 3 and 4. So heart of well developed mammals, that is having 4 chambers. In frog only 3 chambers are there. Upper 2 chambers are there, but this lower chamber is not divided. It is only 1. 2 upper part, 1 lower part, 3 chambers. Whereas in case of fish, only 2 chambers are there. 1 upper and 1 lower. So heart of human being, it is having 4 chambers. These upper chambers, these are called as atria, and lower are called as ventricles. Singular is atrium and singular is ventricle. So 2 atria and 2 ventricles, these are the 4 chambers of the heart. So divided into 2 parts, left and right, due to vertical muscular partition. This one. Then lower and upper chambers, due to walls present in them, 4 chambers are there. 2 auricles and lower 2 are ventricles. Both atria is relaxed, that is they have their original size. These atria relaxed, that is filled with blood. Pressure of the blood is more in atria, less in ventricles. Blood is collected, deoxygenated blood from body parts by inferior vena cava. Here you can see in this 2 veins are shown or 2 arteries are shown. One is superior vena cava, another one is inferior vena cava. So these bring the blood which is deoxygenated blood, that is impure blood. Impure blood from the body parts is collected. It is brought back into the heart by superior and inferior vena cava. Left atria receives oxygenated blood. Here pure or oxygenated, and in this impure or deoxygenated. It is brought back into the heart by pulmonary vein. Keep it in mind. Blood vessels are of 2 types, veins and arteries. Arteries, they have pure blood. Veins, they have impure blood. The veins which we can see in our hand or near the skull or in the neck. Here these veins, these are visible. So those which carry the oxygenated blood, these are arteries, and those which carry the deoxygenated blood, these are veins. But in both there is exception. Pulmonary vein, though it is a vein, it carries oxygenated blood. And pulmonary artery, though it is an artery, it carries the deoxygenated blood. Now here pressure is more. Here the pressure is less. And you know that from lower pressure towards less pressure, the liquids they flow. In our houses we have overhead tank. From the tank the water comes down, because in the tap pressure of water is less, in the tank the pressure of water is more. So now what will happen? These valves they will open and blood will enter into the respective ventricle. From left auricle it enters into the left ventricle. From right auricle it enters into the right ventricle. Then both ventricles they contract at the same time. These both ventricles contract, and Here the blood, it goes into the largest blood vessel, that is the aorta. See, this red one, aorta, it is the largest blood vessel. So oxygenated blood will enter in this, deoxygenated will enter in this. Then it divides and redivides to form minute arteries. They will supply oxygenated blood to all the body parts, and veins will collect the deoxygenated blood from all the body parts. 2 times the blood enters into the heart. From lungs it enters into the heart, then into the ventricle, supplied to the body parts, and again enters into the heart. That's why in case of human being it is called as double circulation. In other animals it may be single circulation, but here 4 chambers are there. Oxygenated blood enters into the auricle, it is supplied to body parts, then it goes into the lungs for purification. Again from lungs the blood enters into the heart. That's why it is called as double circulation. Increasing day by day. In olden times, generally the people when they become old, they had heart attack and they died. But nowadays, even the children of the age 15, 16 or less than that, they had heart attack and they died due to heart attack. What is the reason? Why nowadays the heart diseases are increasing? See, diseases of heart, these are of 4 types. First, congenital or inborn diseases. Means when the child takes birth, at that time the child suffers from the heart disease. First, here this septal wall, it may have a hole. What we have said, here there is pure blood, here impure blood. So due to that, there may be mixing of pure and impure blood as there is a hole in the heart. So instead of supply of oxygenated or pure blood to the body parts, the mixed blood will be supplied. So your body cells, instead of getting pure oxygen, will get carbon dioxide also. Impure blood contains carbon dioxide. So carbon dioxide is not good for our health. The child may suffer from the disease. As these diseases are from birth, these are called as congenital or inborn diseases. First reasons why the congenital diseases they occur. If body of a pregnant woman is exposed to the radiations, alpha, beta, gamma, X-rays, more time the body is exposed to the radiation, it may happen that the developing fetus, developing embryo may have these diseases. Second thing, some of the harmful drugs, these are taken, steroids are taken, then also the diseases can occur. Next, due to infection, you know that bacteria, viruses, they cause various infections. So, if the woman suffers from German measles, you know the measles, कांजण्या त्याला म्हणतात, माहिती आहे ना? But these measles are special type of measles which are called as the German measles. So if the woman suffers from German measles at the time of early stages of pregnancy, that is first 3 months or 4 months, then developing child may have heart disease. Or rheumatic fever caused by bacteria, rheumatism. These joints in the bones, they become stiff, that is called as rheumatism. Arthritis or rheumatism, then also the child may have heart disease. Most common, stress or strain. Due to our busy life, there is always stress. Due to that stress, the muscles of the heart, cardiac muscles, they become weak and a person may suffer from heart disease. And last one, but nowadays most common, that is arteriosclerosis. This is the artery which supplies pure blood. Sclerosis, that is blockage. Nowadays junk food is eaten by most of the people. Bread, then biscuits, all which are made from maida. So these are not good for the health. What happens? Cholesterol and triglycerides. These are deposited on the inner walls of the arteries, and here there is formation of a block. So artery is blocked. Up to this, blood can flow. Due to this, blood cannot flow in this direction. Suppose this artery supplies the blood to your hands. What will happen? Hand will not get the blood. Person will suffer from paralysis of that part of the body. Paralytic strokes, they occur due to blockage in the artery. Why these blockages are there? These are due to junk food as well as three white enemies. First white enemy, common salt. Second white enemy, sugar. And third white enemy is maida. If we avoid this, then it may happen that we will not suffer from the arteriosclerosis. So these are the four types of diseases. And hypotension. The word hyper, that is more, hypo, that is less. Here you can see pressure exerted by blood on the inner walls of artery, that is called as blood pressure. This is the artery. In this the blood is flowing. This blood exerts a pressure on the inner walls of the artery. That is called as the blood pressure. Normally 80, 120, that is the blood pressure. This is lower, that is called as diastolic, and upper, that is called as systolic. Now doctors, they use such type of instrument to measure the blood pressure. You might have seen in the hospitals. This is called as sphygmomanometer. What happens? Here there is a strap. This strap is tightly attached just above your elbow, so that whatever pressure occurs into the artery, that can be measured. So 80, 120, that is the normal blood pressure. If less than 80, then we say that the person is suffering from low blood pressure. If more than 120, then we say that the person is suffering from high blood pressure. So more blood pressure is called as hypertension and lower is called as hypotension. I have a digital sphygmomanometer. See here. SYS, that is systolic. DIA, that is diastolic. And here pulse rate issue. Whenever you go to the doctors, they first see your pulse like this. So that pulse rate, it is also shown by this. This is a strap. This you have to attach here. Anyone can come? Blood pressure is not measured by standing. What precaution you have to take? that this part, heart, and this sphygmomanometer, it should be in one link. Here there is a button for start. So press that button. Machine will start. Now the pressure is coming down. As he is standing, it is not measured properly, but here a figure will come, that is of the systolic blood pressure, and here the figure will come, that is of the diastolic blood pressure. Here the figure that will indicate the pulse rate. Pulse rate, it should be 72 times per minute. You can also have your pulse rate. And if such type of blinking is there, blinking, contraction, relaxation, it means that your heart is not properly functioning. So this is called as the digital sphygmomanometer. Next. No sensation is there, that is called as coma. Then how can we prevent it? First thing, yogic exercise and pranayama. Second, at least walking 2 kilometers, but that is brisk walking, fast walking, 2 kilometers per day, and avoiding the saturated fats. What are saturated fats? Pure ghee, refined oil, that is also saturated fats. Generally we all are using refined oil, but that is not good for the health of the heart. These are called as the saturated fats. And 3 white enemies I have already told about it. Sugar, salt, and maida. Then always have positive thinking. Think that I can do it. Don't think that I cannot do it. Positive thinking should be there. Not getting excited or angry. Generally, it is observed that when we are seeing a match and we are winning, then we get excited. That excitement is not good for the heart. Anger, it kills the functioning of the heart. Functioning of the heart, it is damaged due to anger. So we should not get angry, and do not keep mobile phone in such a way that it will nearer to the heart. Generally the mobile phones are kept into the pocket. So whatever radiations are there, these are quite harmful and they can damage or they can harm the lungs as well as the heart. Taken all types of precautions, but still you suffer from the heart disease, then what can you do? Regular checkup at least after the age of 35 years, because as the age advances, muscles they become weaker. Therefore, you have to do medical checkup after the age of 35 years. Then, in case of arteriosclerosis, bypass surgery is done. What is that bypass surgery? See here, development of blockage. Why? Due to excess of fats, cholesterol and triglycerides, these are deposited. Here the artery is blocked. Now what is done? From the thigh region, from here, this artery is taken. Only the upper part, it is cut by the surgery. Whatever cholesterol is there, that is taken out, and that artery is attached to here. So, artery, and this is the bypass. here there is a block. So this one is the bypass. Just as when roads are repaired, there is diversion. Main road is this. Your bus goes in this direction and then again to the main road. So like that, from here the blood enters into this UR attached artery and then flows here. So that is called as the bypass surgery. Other angiography, angioplasty. Nowadays, heart transplantation is also done. Suppose two patients are there. One patient is whose heart is damaged. Another one accidental death is there and heart is in the good condition. Then heart from the body of that person is taken out and it is replaced at the place of the damaged heart. But here there is one thing, that in particular period of time it should be done. For that the government nowadays is arranging the green road. Means no traffic is allowed from that road. That ambulance can take the heart to the other part and it can be transplanted within the period into the body of the needy person. The most modern technique of surgery nowadays it is done. Here there is a block. So a funnel like structure is there. This is a funnel. It has holes and through a syringe some medicines are introduced inside it. Because of this, what happens? This block, it breaks into smaller and smaller particles. Then by suction, these smaller particles, they come down into this and then these flow in the lower direction or in the upper direction. So big particles of cholesterol and triglycerides, these changes into smaller particles and then they can be flow in the flow of direction of the blood or in opposite direction also. So this is the most modern technique instead of surgery.
On behalf of all of us, I heartily thanks our respected principal ma'am for giving us the valuable information about the heart.